quick conversation to bring forward really cool work that's happening on the ground where people have begun volunteering to help out with COVID. One really simple and elegant idea has taken shape on the ground in Mumbai among doctors as the problem of COVID has now moved from urban India to rural India, where access to healthcare is obviously, as we know, far more difficult. I'm having a conversation with two such doctors, Doctors Marcus and Raina Rane, who join me right now, who came up with the idea that there would be so many of us in urban India who've recovered from COVID and would have medication left over that we're not using right now. They're actually collecting all of that medication and moving it to primary healthcare centers in rural India where it's really needed. Doctors, thank you so much for speaking to me, and thank you for all of the amazing work you're doing. Your project is called Meds for More. Could you tell us what Meds for More is doing right now, and how much medication have you managed to collect so far?
Thank you for having us. We started on the 1st of May. In the first wave of the pandemic, Faye, I was a frontline medical volunteer working with the BMC in the slums in Mumbai. And I saw firsthand the devastation that this disease caused, not just to people's lives, but to their livelihoods as well. And so this time around, as we're all aware, the problem is so much greater. A few weeks ago, a person, his son was diagnosed with COVID-19, and he called me to say, can I show you the reports? And I said, of course. And whilst he was coming, I was chatting with Raina, and I said, what can we do to help with the medications, because they're so expensive? And that's when I realized that in the building that we live in, I had 3 patients that I was treating that had just come out of their isolation. So I put a message on the building group and I said, guys, please, whatever's left over, just send it to me. I'll check it. And then if it's okay, I'll give it to the individuals whose father was coming. And that's where the idea started. And I thought if one building can help save one life, then we imagine what a locality or one city or one country can do for itself.
So I understand you now have 5, you have drop-off points in 5 different cities. Is that correct?
That's right. We've also activated Ahmedabad, Delhi, Calcutta, and Bangalore. And of course, Mumbai is where we started. So yeah, we're live in those cities as well now.
So tell me, what sort of medication, if there's someone watching right now who wants to be able to help out, what kind of medication can they donate?
So we've got a full list available on our website, which is medsformore.org, and our Instagram handle, which is @medsformore. We're principally collecting oral medication used to treat mild to moderate COVID-19. So we're not accepting any injectables, no monoclonal antibodies, remdesivir, tocilizumab, etc. That needs to be given under supervision in the appropriate setting. These are antivirals, steroids, symptomatic control, etc. We're also now receiving pulse oximeters, thermometers, oxygen masks, nasal tubing, etc. So any of the low-hanging consumables which are lying around, we can take those as well.
And how do you process what's been dropped off? What process do you put it through?
So we've actually partnered now with 4 of the largest NGOs in India that work in the health space. Lots of folks would have heard of Gunj, of Doctors for You, the Ratna Nidhi Charitable Trust, and KNHP in Karnataka. So our role is to facilitate raising the awareness. The collections come into the collection centers, and then we deliver it to the NGOs. And the NGOs then have their teams who then check the contents, ensure nothing is expired. We're asking people, of course, to make sure it's unexpired, unused. But in case it does, they'll check it. And then they package it into the appropriate COVID kits and then send it out to the rural parts of India.
So on the screen right now, we're popping up that website and that Instagram handle where you can find more information. But even if people watching right now are not exactly those who recovered from COVID, we could still donate thermometers, oximeters, because that's still something that people need, right?
Yes, absolutely. So we could accept that from people. We have a very simple process. Once someone goes onto our website, there is a you just click on whether you want to donate medicines or you want to become a volunteer, and you can choose to do either of the two. There's a starter kit that gets sent to you with detailed information of how we go about it, which is standardized across the cities. And from there, the medicines or even the thermometers, etc., reach our collection center, and from there on go on to our NGO partners to distribute further to rural areas.
I'll just add, we've made it even one step easier. We've now got a delivery partner. So in the 5 cities that we're active, you can actually get a coupon code, book it via the app, and they'll come and pick it up. So you don't even have to leave home.
That's really cool. And where have you, delivered the medication so far?
So we've collected, as of yesterday, 125 kilograms from Mumbai alone, which is where we started. And all of that went out over the weekend to the 4 NGOs that I just mentioned.
All right. Thank you so much for speaking with me, and I wish you very, very good luck. And for our audience who wants more information, it's on your screen right now. You can get in touch with them. Do inform other people you know who have recovered from COVID and who have medication lying around the house that can be of use to someone else. That's the simple, very beautiful idea that these doctors have come up with, and we can find ways to help them. Thank you so much for speaking.
Thank you.
Thank you.